Africa's health experts want to establish an urgent team to respond to medical emergencies on the continent, as according to the president of the Africa Academy of Sciences, Professor Felix Dakora.
He says Africa must not wait for outside help to deal with health crises. He was speaking at the opening of the DELTAS Africa Scientific Conference in Dakar, Senegal.
In 2014, West Africa was hit by the worst ever Ebola outbreak. The disease affected more than 29,000 people and killed over 11,000. To contain the spread, international health experts were deployed to the affected countries, including African health workers. The success of these teams partly what now informs a decision to form a standby committee of African experts to deal with health emergencies on the continent.
It is sad that whenever we have any outbreak in the continent, we literally have to sit down and wait for colleagues who are experts to come from overseas to come and address the problem. And indeed, some of you may know or you may not know, but when this happens and they go back, we actually hardly have access to the data. We don't know where the data is gone, and when the same outbreak comes back, we don't know where to fall upon for experience in order to resolve the problem.
Under the umbrella of the African Academy of Sciences based in Nairobi, the network will seek to work closely with the African Union to ensure representation from each of the continent's 5 regions.
We need to have regional representation. So if the outbreak is in West Africa, it's important that there is a West African vice chair of it that will then alert the others, and immediately we can respond to it.
Meanwhile, young African researchers will for the next 2 days present their groundbreaking research findings at a meeting in Dakar. Their research focuses on some of Africa's health challenges, including malaria, HIV/AIDS, maternal and child health, among others.
The science is really leading the policy, is a policy driver, we can say that, for the Ministry of Health.
You and we must use the next round of DELTAS funding as a trigger moment to catalyse new and stronger funding partnerships. This opportunity comes around once every 5 years.
The African Academy of Sciences works with African universities and research institutions to train and retain health researchers as the continent seeks to bridge its huge human resource gap. Sarah Kimani, SABC News, Senegal.